we begin with a story that we've been tracking for weeks now. What exactly is the death toll in India's COVID fight? COVID 1.0 and 2.0. Now today, these are the figures that have created a lot of alarm because suddenly the figures have crept up to 6,148 in the last 24 hours, the highest single day spike. Only yesterday it was 2,219. On May 18th, it was 4,529, the previous high. But there is a reason, a story behind the numbers that I want to lead with. Because as India records its highest death toll due to COVID in a day, the jump from 2,219 deaths to 6,148 came largely because of a revision of tally done by one state, the state of Bihar. An audit of the deaths by the Bihar government has found nearly 4,000 deaths that were not detected earlier. And once the revision came, the politics followed. But the question is Bihar alone? Is every Indian state undercounting, or some saying lying about its COVID death toll? It's our top story today.
A drastic revision from 5,500 to 9,429 deaths. A staggering 72% jump in Bihar's COVID death toll. The spurt came on Thursday as the Bihar Health Department added 3,951 unaccounted deaths in the state's COVID tally. The new figures came after an audit ordered by the Nitish Kumar government. The audit itself was the result of intense pressure from the Patna High Court over suspected undercounting of deaths in the state. Bihar's health minister was quick to defend the state government.
सरकार के स्तर से ये कहा गया है कि यदि किसी भी स्तर पे किसी व्यक्ति के द्वारा लापरवाही समझ में आएगी तो उस पर कार्रवाई भी होगी.
The opposition, however, is unsparing in their attack. The Congress has accused CM Nitish Kumar of lying to the people.
सरकार कह रही है कि 1200 लोग पटना में मौत के शिकार हुए कोरोना से 7 जून तक. फिर 8 जून को कह रहे हैं कि नहीं ये 2200 है. तो ये जो आंकड़ों में हेराफेरी है यह कहीं न कहीं बताता है सरकार ने इसे गंभीरता से नहीं लिया.
The RJD claims Nitish Kumar's double-engine government is thoroughly exposed.
सरकार पूरी तरह से एक्सपोज हो गई. पहले कोरोना जांच घोटाला हुआ पिछले बार, इस बार कोरोना से हुई मौत का घोटाला सामने आया है.
The ruling party on its part claims it was their government that ordered the audit and the High Court had no role to play.
लोग सरकार पर आरोप लगा रहे हैं कि सरकार ने मौत के आंकड़ों को छिपाया है. लेकिन ऑडिट कौन करवाता है? ऑडिट भी तो सरकार की तरफ से ही किया गया है. जांच टीमें बनाई गई हैं और प्रत्येक जिले में जांच हुई है, उसके बाद अनियमितता सामने आई है.
With the revision in Bihar's death toll, India for the first time since the pandemic started reported over 6,000 deaths, a grim new milestone.
There was always doubt that the Bihar government was under-reporting COVID death numbers, especially during the second wave, and it's only after the Patna High Court shared similar sentiments that the state government was compelled to conduct an audit in this entire matter, as a result of which overnight the death toll increased by almost a whopping 4,000. The opposition claims that this entire exercise to keep the numbers less was deliberate on the part of the state government and are now demanding a detailed investigation. With camera person Deepak Kumar, this is Rohit Singh in Patna for India Today.
My first guest tonight, Ajay Alok, the JDU leader and spokesperson, joins me from Patna. Dr. Alok, let's be very clear. Almost 4,000 additional COVID deaths now being reported by Bihar. Doesn't this expose the worst kept secret that states like Bihar were deliberately underreporting deaths for the last several months? That's the shocker that's come out today.
Well, Rajdeep, for the first time I am listening that here is one state in whole India which is changing its numbers on its own, which is conducting an audit district-wise, and then the state comes up themselves and they say, and a press conference is chaired by none less than a chief secretary rank officer, who is also the principal secretary health, and he says that no, There was deaths not 5,400, but there are deaths amounting to 9,200. And still there are 7,500 active cases in the hospital, and this number can go up. And we are also taking into account to give compensation to those who have died post-COVID because post-COVID complication, and still they have not been registered as COVID death. So all these things we are doing, and still you are saying that we have been exposed.
You
I
have
don't
been
think anyone in politics exposes themselves.
Dr.
You get exposed
Alok,
by others, but here is the government.
Dr.
Here is the
Alok-
government who is admitting that your death count has gone up.
Dr. Alok,
but in
I'll
whole
tell you
India,
why.
give me
I'll
example of one government who has said that death count has gone up.
Please don't take the moral high ground so easily, Dr. Alok, because the fact is, isn't it true that it is only after news channels like India Today showed how bodies were found floating in Buxar in Bihar that the High Court intervened, demanded an audit, and that your government woke up? You didn't audit the deaths accurately all this month. You cannot now suddenly say that the Nitish Kumar government is being transparent because you were not all these months. You woken up only after the High Court.
Well, let me tell you, the pandemic hit us in the last week of March and in the first week of April. And suddenly there was all chaos and there were all panic, and 75 to 80% of administration were busy in just preventing life, preventing infection. The death audits from different districts, yes, definitely they were delayed. So a committee was constituted, and there were 10 members in every district which went on and collected the data and submitted to the government. And still that work is going on. This work is not over. Rather, you should say today, Rajdeep, that all other states should take lessons from us and they should come out with the exact numbers now.
Sir,
because this death toll is rising and it will rise for the next 2 months also. But none of the states are doing it. The question is not being raised for others, but the one who has exposed themselves, who have admitted that deaths have gone up, you are saying that we have been exposed.
No, in fact, Dr. Alok, this country at the moment is divided between states that are conducting audits and those that are not. Let's be honest, there are some states that have been conducting monthly audits and revising their numbers. But Bihar and Nitish Kumar, Dr. Alok, were going around claiming that your case fatality ratio, or Bihar's case fatality ratio was low, that COVID was completely under control, and they were pointing out to the low death figures. And therefore, now you've been exposed because of a high court ordering you to do an audit.
No. Many other states have done the audit, but see the difference in the audit report. The classical example where you are sitting right now, Delhi, the actual death certificate issued is 34,000 and the death report is 11,000. There's a difference of 21,000. Can you find that difference in Bihar? No. The death audit must be authentic. And the similar thing, where is Rajasthan? Where is Maharashtra? Where are other states who have done the audit? We have done it for ourselves. We have done it for ourselves. We don't need applause for that. No, it was nothing. There was no High Court order.
There was a High Court order.
Rajdeep, there's a difference between order and there's a difference between observation. There has been no High Court order on that. None of the High Court told us to do an audit. On the
there was an observation.
Case, there was an observation from the High Court why there is a difference when we have 783 bodies coming up in the Ganga and you guys are showing only 69 bodies cremated. Why is the difference? That was an observation. That was not an order.
You know, Dr. Alok,
Bihar government is a responsible government and we are doing our job.
Dr. Alok, we can argue on semantics between an order and an observation, but let's just accept that many states, including your state, have hidden COVID numbers, and that's dangerous to hide the real numbers from the country. In fact, our reports from Bihar over the last several weeks have shown that in many districts, if a person dies at home because of suspected COVID, it doesn't get reported or gets reported in the death certificate as pneumonia or some other comorbidity. So actually, not only have you hidden numbers, but the fear that many have is your final death count in Bihar could be even higher than 72%, which is already being reported.
We have not hidden the number, rather we are the only state who has written to the center that even the RT-PCR report is negative, but the CT scan findings are positive. We are treating them like a COVID positive patient, so please pass on the guidelines. And the center is taking a look on that also. We are doing everything very scientifically. It's not, nothing is going unscientifically here. We are taking those numbers who have died of post-COVID complications. We are taking those numbers who have been testing RT-PCR negative, but still features of COVID. So everything is being accounted now. Every district is doing that. So I'm telling this is not the final number. This number can go up.
Okay, so you don't want to accept that the Bihar government has, in a way, deliberately carried out, as some are saying, a disinformation campaign, spread some kind of myths around its COVID functioning, dressed up numbers. You seem to be suggesting that all is well, that Bihar has COVID completely under control. Is that what you're saying?
Entire data account which was submitted by Bihar government yesterday is absolutely perfect data count, which have been assimilated over a period of last 20 days after doing audit. Still, one thing is left, that many private hospitals who have not updated their deaths on portal, they have been served with notice that please update your death portal within 48 hours, otherwise actions will be taken. Now the heads will roll on those district officers who have delayed this data assimilation. So as a responsible government, it's our responsibility to know how many deaths have occurred in our state and what best we can do for the third wave.
You know, but isn't all of this a reflection of the track record of the manner in which certain states are handling COVID? You know, it's all about propaganda rather than the reality. And states, including Bihar, now will be accused of being less than transparent with your numbers.
Never myth. There was never a myth created by Bihar government. Bihar government has been honest since the first wave. What we did, it in front of everyone. Bihar was the only state which distributed 1,500 rupees from its own pocket to all the migrant laborers who came here. Bihar was the only state that, other than the central grant, we distributed free rations. We have been honest and we have been transparent right from the beginning, from the first year and second year. And Bihar is the only state now who is admitting that in last 1.5 months, the death ratio has gone up by 3,400.
Well, let me only say this, Dr. Alok. What Bihar therefore then thinks today, by revising these numbers, I hope other states will also do so. It's time to get honest with data, because only then can we really prepare for a possible third wave and have public health implementation done in a proper manner. Thanks very much, Dr. Alok, for joining me there on Bihar's revised death data. Now, let me turn from there to a public interest issue again that should concern each and every one of us. Remember, 9 big, and take this very clearly, 9 big corporate hospitals in the country procured 50% of the vaccines made available to private players in the month of May. Now, most of them were serving the big cities. What happened as a result? Smaller hospitals, clinics in rural India had no access to the life-saving vaccine against coronavirus. As India enters a critical phase in the fight against COVID, questions are being raised over vaccine equity and access. The big questions: are the big chain hospitals cornering the vaccine doses in the country meant for all private hospitals? Are the smaller hospitals in particular losing out? Is this flaw causing serious regional imbalances? How will one ensure fair distribution of vaccines in the country? I'm joined by Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity. Dr. Giridhar Gyani is Director General, Association of Healthcare Providers, that represents 11,000 small hospitals across India. Dr. Pankaj Solanki is the owner of one such hospital, Dharamveer Solanki Multi-Speciality Hospital. And Dr. Shashank Joshi is member of the COVID Task Force of Maharashtra. Dr. Trehan, to you first. 1.2 crore doses were procured by private hospitals in the month of May. 61 lakhs of those were bought by 9 private hospitals, and 59 lakhs were bought by 300 remaining private hospitals. What does that show to you? That if 25% are reserved for private hospitals, but 9 hospitals corner a majority of them, how will we ensure vaccines for all?
I have from day one saying that we need to go for equitable distribution, and the system that was working before June was the best system, in the sense that the vaccine was all bought by the government, whether it was to be sold through the private sector, and we were buying it from the CMO, so everybody got a chance to get the vaccine, even small people, for the reason that some bigger hospitals will need larger quantities, and the smaller ones will need smaller quantities. And for the people who need smaller quantities, they need to have an equitable central distribution system. And I think the government, in its rethink, because it under pressure from the states, it had liberalized the system, which has gone a little awry. So now we say that government is now procuring for the states also, and I think that they should procure for the private sector also.
No, you're making
And
an
then
important
this-
point. Just a minute. You're saying something important. You're saying that even the 25% that is meant for the private hospitals should not have private hospitals dealing directly with Serum or Bharat Biotech, but should be procured from a central pool. Am I correct?
Yes, absolutely. And I have been saying it from day one that that will be the only way we do equitable distribution.
Okay.
Now, there can be some allocation for industry to the hospitals in their locality so that nobody can corner the vaccine. And I've also said from the very beginning, please cap the amount that the hospitals can charge for as a service charge for delivering the dose. So I'm so happy that the Prime Minister took that decision and said 150 rupees is what the hospitals can charge above the price of vaccine that they buy.
But even so, at the moment, private hospitals can continue to directly negotiate with Serum and Bharat Biotech. I just want to, for a moment, bring in Dr. Girdhar Gyani, Director General Association of Healthcare Providers, that represents many of these small hospitals. You have been in email contact, Dr. Gyani, with Serum Institute. What was their response when you said, we also need vaccines? You can't just give the vaccines to the big hospitals.
Yeah, that actually we really took a lot of effort and time with the Serum Institute. And finally, I think we were able to put the pressure on them. And they then agreed to that 28 hospitals of the Eastern India, where there was a heavy shortage of the vaccine. They said 28 hospitals will supply 3,000 doses for each hospital. That agreement has been arrived, and many of our hospitals have paid the money also. So that is something has happened. And one thing I will like to say that this is not in the public domain so far. What Dr. Naresh Trihan was saying, that government has issued the guideline based on our letter to the government that now even the 25% doses can be procured from the private hospital, but coordination will be done by the state government. This is a new thing which has come only yesterday. Because by this arrangement, the smaller hospital which were left here and there by the Serum or by the biotech, now the state government will be able to say, no, please provide so many doses to so-and-so hospital geographically.
So it is a step forward. I take it that it's a step forward, but let me put some hard data again. And Dr. Shashank Joshi, you should respond, because Maharashtra, you're a member of the Maharashtra Task Force, and it has reported the highest number of COVID cases. There are 57 private hospital vaccine sites in Maharashtra. 19 are in Mumbai, 23 in Pune, which means 42 of the 57 are cornered by the two big cities of Maharashtra. The fact is, many of the new COVID cases have come from the districts of Maharashtra. How are the vaccines going to reach the districts?
There are two things very clear-cut, Rajdeep. That 75% of the vaccine will be done by Government of India, and that will be done through the state government. And the 25% has to be done equitably, but controlled and supervised by the state and the center both. And the distribution and the logistics have to be supervised or coordinated by the government, and government has done its course correction. So I don't think after 21st of June, these problems will arise. And our current challenge, Rajdeep, is we need to vaccinate as early as possible, as quickly as possible, as many people as possible.
But it cannot just be the big cities. You are now telling me, or most of you are now telling me, that things will get better from the 21st. Great. But over the last several weeks, what's happened in this country, Dr. Joshi, and in Maharashtra, is that most of the vaccines have been cornered by the big cities. Of that 25%, it should go to hospitals across the state.
So, Rajdeep, I would like to tell you two things. One is district-wise vaccination, which has come from the central government, has continued. That has not stopped at any cost. And there is still some amount of vaccine hesitancy in rural India and rural Maharashtra. But I would agree with you there that we need to open up more private centers in the smaller districts and each district of each part of India, not just Maharashtra.
You know, I just want to put it, I just want to throw more data. Tamil Nadu, 23 private hospital vaccine sites, 16 are in Chennai. Karnataka, 52 private hospital vaccine sites, 25 are in Bengaluru city alone. So clearly there is a skewed distribution of vaccines at the moment. Dr. Pankaj Solanki, you're an owner of a private hospital in Delhi, but I'm told you also have found it very difficult to procure vaccines.
Sir, I'll tell you sometime what has happened, that we are finding it very difficult to procure the vaccines for last 1 month or so. Now, when you're talking about the number, there are 136 private hospitals which are actually vaccinating till April to the people. And if you take the minimum figures, they could have easily vaccinated around 20,000, around 2 lakh people a day. But our thing is that a vaccine is being made available to only limited set of hospitals. Those are like corporate hospitals. And if you make them available to only 8 to 10 hospitals, there are still 126 to 128 hospitals left. And that cannot be a small number because each hospital has
give me your example. Did you ask for vaccines? How many vaccines did you get? Vaccine doses did you get in the month of May?
In month of May, I had on 1st of May, I had 150 doses of Covaxin.
Right.
And what I was told over a telephonic call that I need to submit it back to the government, otherwise it will be taken as a case of hoarding. So I submitted those vaccines back, and I did not know from where to procure the vaccine.
You could not directly contact Serum, or you could not directly contact Bharat Biotech, presumably because you are not big enough to deal with them. Am I correct?
We are not big enough to deal with it. But if you talk about the number, there are 128 or 120 smaller hospitals,
right,
private hospitals, which could actually easily make up a big number.
No, you're making a very important point with Dr. Trehan. These are private hospitals that can really, in a way, help in augmenting India's vaccine drive. The question is, as you said, private hospitals, which are large corporate hospitals, can directly deal with a Serum, can directly deal with a Bharat Biotech. They have the muscle to do so. The smaller hospitals don't have that. Do you therefore believe that even today, as you said at the outset, the government should also course correct here and say, look, even that 25%, we will now spread it across hospitals depending on the size of the hospital?
That's correct. I firmly believe that, because we knew from the very beginning that some of the larger chains could corner vaccines. I'm telling you, we are a reasonable sized hospital operation. Even I had difficulty getting 30,000 doses. So I'm saying that there has been a skewed system here. This had to happen when there is a mismatch between supply and demand. Then people who can take advantage will take advantage, which should not have been allowed from the very beginning. I don't think it was
have you spoken to the government, Dr. Trehan? Have you raised this with the government?
Of course, I have even written to the government. Even from CII, we wrote to say, please cap the amount people can charge.
No, that is done. The capping of price is done. The capping of price has been done. But this other demand, that private hospitals should not directly negotiate with Serum.
No, because it's very difficult for smaller people or for the whole country. There are 60,000 hospitals who have to negotiate with these companies. The system was working quite well, because what would happen was, like Gurgaon district got its allocation. We went and bought it from the CMO. They knew exactly how many patients we have registered. Those doses will come in the morning. We would give those 2,000, whatever we could do during the day. I think that we need to actually spread the vaccine all across the country. And I'll give you another program that we have started from Vedanta. We have taken part of our vaccines, about 20% of it, and offered it to give free in camps around in the bastis of Gurgaon. So that we already started these camps,
right,
and we are giving it more to people whose livelihood depends on being healthy. So like the Redi Walas, the Kinara Walas,
right,
we are giving them vaccines at their workplace.
No,
those
are all,
don't have to miss a day's work.
Those are all laudable steps, but we need an institutionalized structure so that this happens across the country at the moment. We cannot afford some parts of the country, particularly Eastern India is losing out, as Dr. Gyani said. Many of the hospitals in the East and Northeast have lost out. But Dr. Solanki, you want to make a quick point? Yes.
See, these 120 hospitals I was talking about, or I'm talking about, they are located in the remotest part of the Delhi. And those 11,000 hospitals Dr. Gyani sir is talking about, they are located in the remotest part of the country. And we are looking at the third wave. We might be expecting the third wave, maybe as per the predictions, it may come in a month of 3 to 4 months of time. But if we cannot make the vaccine reach out to these hospitals, to these the remotest area of the hospitals, then we then sadly we'll have to see the more mortalities than we saw it in the second wave.
Sir, you're absolutely right. There are parts even within Delhi which are not getting as many vaccines as other parts. So the equity difference takes place at different levels. Dr. Gyani, have you been assured this time that these gaps, these areas, these dark areas like parts of the east, northeast, remote areas, private hospitals, small hospitals will get the vaccines this time?
Yeah, as I told you, Serum is already supplying to these 28 hospitals, including in Manipur. But now with the new order, there is even paragraph which many people have not noticed, but I told you that this will be now monitored through the state government. So no hospital, big or small, will be able to get from the Serum or Bharat Biotech without the coordination from the state government. So that is one thing. Second point, let me tell you, very important point here. This 11,000 hospitals which are in the remote areas, I can tell you 30% of Indian population is totally hesitant for vaccination. So only the next door nursing home or small hospital will be able to convince these people to go for vaccination. So this is another dimension which must be taken into account.
Very, very important. The nursing homes become also important. Now, there are of course some states that are talking as a result of door-to-door campaigns also at some stage to be launched. Do you believe, Dr. Joshi, that will have to be done at some stage or the other, particularly in a state like Maharashtra, which has suffered so much in the last few months?
If the vaccine is safe to be administered at home, it can be given at home to people who are disabled or who can't make it. But I think the first important thing which we need to understand is that currently there is a course correction. Every supply which comes out from both the manufacturers or the three manufacturers is known to central government, and that will be supervision of center and state both in the distribution, geography and equitable distribution, whether it is private or public both.
So, is the Maharashtra government aware? Is the Maharashtra government aware that most of these vaccines have gone to Mumbai and Pune private hospitals?
I don't think so that everybody is aware. Of course, they are aware of it. There is very clearly that data is there. So data cannot see everything.
No, so will you ensure that Nashik, Nagpur, Amravati, places which have been badly hit will also get it?
And now with the system in place and now that the new order in place, there will be exactly not, now we only know the tracking. But now we will exactly know that everybody has got it equitably and state will have a say in the equitable distribution.
Okay. Those are positive thoughts. But as I said, our focus really was to perhaps ensure, at least at the moment, that parts of the country that have lost out get adequate vaccines, particularly private hospital. A final word from you, Dr. Trehan. Are you hopeful that the government will course correct now and ensure that every private hospital gets vaccines in proportion to the patient volume that they have? Do you believe that the government has understood this now?
Yes, of course. I think all the course corrections actually been done already in the last 3 days. But what will also help is that we are expecting that the supplies of vaccine doses will go up exponentially at the end of this month and by the middle of July. So if that happens and this equitable system of distribution stays in place, we will see the nation getting the vaccine. Now, let me give you a quick data here. If we can vaccinate 50 lakh people a day, 50 lakh jabs, we will cut the third wave by 25%. If we can vaccinate 70 lakh people a day, we will cut down the wave by 50%. If we can get up to 90 lakhs a day, we can flatten the wave. So that's the power of vaccination. So we really need to get down to the job, use every resource, whether it is door to door, whether it's holding camps, whether it's going to marketplace or opening large centers in schools and halls. Everything must be done. The only thing, and we have the capability of going up to 1 crore a day. We do have the capacity between government and the private sector, but we need the vaccine. That's the key word here.
Okay, we need the vaccine, and once the vaccines come, importantly, we need to ensure that they get widely distributed equitably across the country. That is equally critical. Every Indian citizen's life matters, whether it's in Manipur or in Maharashtra. Thank you all very much for joining me here on the news today and my talking point. Let's turn to our other top focus today. A new report in Vanity Fair magazine throws even more light on possible US government interference that prevented studies on the origin of the virus in China that has sparked the world's worst pandemic. There are now multiple reports that clearly hint that the virus could have leaked from the Wuhan Institute of Virology. This throws new questions, also opens up a debate over an alleged cover-up bid. In a moment, we'll be joined by an author of that magazine article, but first, a look at this report.
A new investigation published in a venerable American magazine has made a stunning claim. It says that the United States government tried to cover up reports of the virus emerging from a lab in Wuhan's Institute of Virology. The report in Vanity Fair says the United States State Department hampered a probe into COVID-19's origin at every step because it feared the findings would draw attention to the fact that the US government was funding the lab. The revelations come at a time when there's a global cry for clarity on the origins of the virus, with fingers being pointed at China for hiding facts.
We would, though, like for everyone out there to separate, if they can, the politics of this issue from the science. This whole process is being poisoned by politics.
The damning expose of the US State Department follows the claims that the Dr. Fauci-headed NIH had funded gain-of-function research at the Wuhan Institute of Virology. Fauci has denied, though, that the US funded the controversial study in Wuhan. Bureau Report, India Today.
And joining me now is the author of that Vanity Fair magazine article that hints at a cover-up in the very top in the United States. Author of Bottle of Lies, contributing editor at Vanity Fair, Catherine Eban joins me. Appreciate your joining us. Catherine, you've come up with some stunning revelations on the Wuhan COVID lab leak theory that the world at the moment seems to be obsessed with. In fact, your article, you suggest that the former secretary to the Bureau of Arms Control in an internal document had written that his bureau was warned in the US not to pursue an investigation into the COVID virus because it would open a can of worms. Do you want to tell us today, Catherine, what was the can of worms that they feared would be opened if they carried on their investigation into the Wuhan virus?
Thanks for having me. So the can of worms is risky research known as gain-of-function research that the U.S. government has been funding through grant money, and which some of that money went to the Wuhan Institute of Virology. The gain-of-function research in question is manipulating pathogens to see if they can become more infectious to humans. Some of the grant money was given to an intermediary who in turn routed that money to the Wuhan Institute of Virology. What my sources indicated to me is that there is a big gain-of-function bureaucracy within the federal government. So there's been support for this kind of research. That research was going on at a laboratory 7 miles away from the Wuhan seafood market. And there are questions about whether it is possible that COVID-19 began as some kind of accidental or unintentional lab leak from that facility.
So you seem to be clearly hinting that there was a cover-up at some level, but you also say in the article that the idea of the lab leak first came to the NSC officials in the United States, not from the Trump administration, but from Chinese social media users and some Chinese virologists who began sharing their suspicion as early as January 2020. So in a sense, there seems to be this seems to be building up for a while, and it's only now that the idea that this was a Wuhan lab leak is catching traction.
Well, that's right. I mean, early on, there were even 2 Chinese researchers in Wuhan who put up a preprint article saying, we've surveilled this area, and there are these 2 big labs that are doing this coronavirus research right in the area of the outbreak. And they've collected this extensive, armament of viral bat samples. And so we believe that this has come from a laboratory. Now, that paper was immediately taken down offline, but not before it sort of put U.S. government officials on notice They in turn began probing the Wuhan Institute of Virology, the kind of research they were doing, and it raised a lot of questions.
So this was happening in Jan of 2020. Do you believe in a sense that had this investigation been carried to its logical conclusion over the last 12 months, perhaps all that we are learning about this lab leak at the moment could have come out earlier? Let me be more direct. Are you now, first of all, more and more convinced of the lab leak theory?
I'm not convinced of anything, and our article comes to no conclusion. What our article does clearly indicate is that a comprehensive investigation was blocked due to conflicts of interest.
But you also raise another interesting argument in the article that you've written about mutation. You cite Alina Chan in the article to say that the early sequence of the virus showed little evidence of mutation, and had the virus come from an animal source, there would have been multiple mutations. But isn't it a matter of fact that the world is seeing thousands of mutations? Does it in that sense also weaken the lab origin theory?
You know, there's a lot of scientific evidence on one side of this argument and the other. And there is a lot of scientific disagreement. One of the issues we raise is the fact that there really was no scientific consensus from early on, even though one was essentially manufactured.
You also mentioned, Catherine Eban, a 2012 incident of the Moijang miners who were assigned to shovel out bat faces from a mine floor, and the disease they developed is strikingly similar to COVID virus. Does it mean possibly that the virus was out there and the Chinese knew about it as early as 2012, kept it a secret, this gets leaked later to the world? Is that a growing possibility now?
I think it raises a lot of questions about why China was not more candid and forthcoming about what was uncovered in that mine. There were a lot of samples and viral sequences that were taken from that mine to the Wuhan Institute of Virology. The problem is the database in which those sequences were all logged has been taken offline. It was taken offline 3 months before the start of the pandemic. So we really don't know what kind of viral sequences the Wuhan Institute of Virology was working with.
But at the same time, it's not just your article, Catherine Eban. More and more US scientists, people in the field, are suggesting the possibility of a strong indication that it was the lab where the infection started. And now that more and more people are talking about it, where do you think this leaves the entire lab leak theory? Will it actually get pushed forward or not?
Well, you know, what the most credible people here are calling for is a thorough investigation. And what they're pointing to is the fact that this investigation never occurred. You know, the World Health Organization, in a mission that they helped to organize, a group of independent experts went to China and really only gave a sort of cursory exploration of the lab leak hypothesis. And on the basis of that, they deemed it to be improbable. But, you know, what experts are pointing out now is that there has been no real proper inquiry that allows us to take the lab leak hypothesis off the table. Now, President Biden has said as much himself recently. He has directed his intelligence agencies to go back to the drawing board and to give him a report in 90 days as to what they may find. You know, so this raises the question of, what does the U.S. have in its files? Do we have any evidence that can help us move this question forward? Because China has already said it's done. It's not going to allow any further inquiry. We're not going to be able to see lab notebooks. We're not going to be able to see raw data. So, you know, governments on their own are going to have to look at what they've got in their intelligence files.
But that's precisely the problem, isn't it, Catherine Eban, that scientists, including the likes of Dr. Fauci at the top of America's medical administration, that the World Health Organization made the mistake of providing a clean chit to the Chinese too soon. Is it too late, therefore?
It may end up having been a mistake. You know, if in fact it ends up being a mistake, there's a difference between a mistake and a conspiracy. So one of the things that I tried to do in my reporting is peel away the wild conspiracy theories that are circulating out there. This has been so politicized. I'm not sure if we are looking at a grand conspiracy so much as a kind of failures that were driven in part by conflicts of interest,
which could have resulted in a grand cover-up. So my final question now, Catherine Hepburn, now that you've got a new administration in the White House promising a thorough investigation, all these articles coming out, do you see the truth ever coming out of what happened in Wuhan?
Well, that's a great question. I don't know the answer to that. Of course, I think it's immensely important for the world to know where this originated, because it has huge implications, right? If it came from a lab, we have to completely overhaul how this kind of laboratory work is regulated. If it came from nature, we have to really rethink, our incursions into these wild places. So it has huge consequences for the future. I'd like to think that we will one day get to an answer, but I'm not sure.
Catherine Hepburn, you've joined us there from New York. Thank you very much. And to your investigation into the Wuhan lab leak, lots of data coming out of that article. Thanks very much for joining me. Let's turn from there to our Get Real India story. It comes from my home city of Mumbai, where monsoon, Mumbai and waterlogging go synonymous with each other. Year after year, nothing seems to change in India's financial capital. And as the mayhem now continues, there is one problem. Over the last 5 years, 300 Mumbaikars have lost their lives after falling into open manholes or gutters. Vidya has today's Get Real India story.
Flooded roads, open manholes. It's a problem Mumbai confronts every year. This CCTV footage is from Bhandup, where two women fell into an open manhole. They were saved in the nick of time.
Now what happened is, this is the main Bhandup village road, and yesterday due to heavy rains, the whole road was completely flooded. Now what happened is that due to water pressure, this whole manhole was completely open. People, what here they do is they keep this huge rocks over here, but due to water pressure, this whole manhole was opened, and people who are passing by, they kept falling in this manhole.
The locals claim this is not the first time such an incident has taken place.
बहुत आदमी इधर गिरा, मेरे को मालूम है, इसके लिए बोलते हैं आपको। पूरा पब्लिक है ना, जो साइड से आते हैं वो लोग है ना इधर ही गिरा। कितना आदमी को संभालते हैं, नहीं होते। अभी इधर रस्सी बांध के रखा था, लेकिन फिर भी है ना पब्लिक को मानने पड़ते हैं, लेकिन साइड से आते हैं।
तो पहला पानी हमारा विलेज रोड में पहला पानी भरता है, और भरेगा पूरा गटर का ढक्कन खुल जाता है, और इधर कोई आता नहीं है देखने के लिए। बच्चे लोग अभी तो चलो स्कूल बंद है, तभी तो स्कूल था, तो स्कूल बच्चे लोग इसके ऊपर से चल के जाते थे। लोग इन बड़े लोग खड़े रहते थे कि इधर से मत जाओ, उधर से जाओ करके।
In the past, many Mumbaikars have lost their lives after falling into manholes. The issue got national attention in August 2017. Dr. Deepak Amrapurkar slipped down into an open manhole at Elphinstone Road. The doctor's body was later found in Worli. In July 2019, a 2-year-old boy fell into an open gutter in Mumbai's Goregaon. He too lost his life.
2013 से लेकर 2019 तक 742 घटनाओं में कुल 367 लोगों के मारे जाने की जानकारी प्राप्त हुई है। मुंबई में हर साल इस तरह की घटनाएं होती रहती है, लेकिन महानगर पालिका ने अब तक इस पे कोई भी सीख नहीं ली।
BMC has finally woke up, and after this incident, they are over here replacing the manholes with a better quality. Now they are saying that this manhole are such quality that due to that heavy pressure, they won't come up. Now the big question still remains is that the BMC has the budget of over thousands of crores, but why this is not done before monsoon? Many lives could have been saved till now. With camera person Prashant Bhatt, this is Saurabh Bhaktania in Mumbai for India Today.
Some things will never change. I reported similar stories in the late 1980s. We're now in 2021. Let's turn to our good news story. And this is a wonderful story of a woman doctor who battled the deadly coronavirus for 10 days on a ventilator post having just delivered a child. Now heartwarming images have come out of the lady doctor holding her baby for the very first time that have gone viral on social media. The story from West Bengal.
It was an emotional moment for Dr. Arfa Sajadin. She can't hold back her tears as she holds a newborn baby for the first time. COVID positive, Dr. Sajadin was separated from her baby soon after the delivery.
Baby was large for gestational age and there were signs of fetal distress actually. So when baby got delivered, baby didn't cry immediately. He required oxygen support. Fortunately, he didn't require any ventilator support or something like that. But again, he has to be kept for around 2 to 3 days in our NICU setup. And one more thing, luckily, like the baby didn't get any COVID infection from mother.
She herself was on ventilator for 10 days. She won the battle against the virus this week.
The most important part I could do in my life is that unite them. I was having in my mind, like we were thinking left and right, day and night, how to take her out. Like during her illness, when she was on ventilation, there were a lot of complications. She had convulsions and many other things. It took a lot of effort actually to take her out of the crisis. And when she go home safely, that was the biggest proud moment of us.
It is the story of courage where Dr. Arfa fought death to be united with her baby and experience the joy of motherhood. With camera person Raktan Das, Prema Rajaram in Howrah for India Today.
4-letter word, hope. Umeed pe duniya kayam hai. Let's leave you with our image of the day, and it comes from New Jersey in the United States, which has captured a partial solar eclipse, creating a spectacular crescent that floated over the sea, painted the sky red. On that note, thanks for watching. Stay well, stay safe. Shubh Ratri. Good night.